Thank you very much, sir, for giving a nice introduction. As sir told before only, we are very much exposed to a COVID, and COVID is a hot topic today. There are so many pros, cons, and there are so many things that we don't know. There's certain things we even medical person are not knowing regarding COVID-19. So I today briefly introduce what is the COVID, specifically what is COVID, what we are treating, and then after next part I will just tell that how we can prevent for getting an infection by doctor also and the medical representative which whosoever going to come in our daily activity. So first of all, coronavirus is corona family. It looks like a crown. Crown means you are well known crown. So its name is corona. That is why they put the name is corona. And COVID-19 is one of the sub family of corona family. As we know, there are corona is there in world since long. Specifically, if you see Middle East respiratory syndrome, then SARS, that all are a coronavirus. And nowadays, that is new mutation is there, and that is called as a new corona or novel corona. But because we need to name it, so we have named it as COVID-19. If you see why is they name it COVID-19, because it's a coronavirus disease 2019. So this is the basic of COVID-19. This is a basic slide that everyone knowing that we should have to keep at least 3 to 6 foot distance and social distance. Why is important? Because whenever any person coughing or sneezing, they will generate a aerosol that will sustain in a environment at least surrounding of 1 meter, and it sustain for 30 seconds to 3 hours. And then after that droplet fall down on surface, and by the touching or coming in a hand that come in contact with our body, and gradually they will spread the infection. That is the basic for a social distancing. Now another problem why is happening, how no. See, there was an epidemic of unknown pneumonia in 2019 December in Wuhan city, and that is why they subtitled and found that is the coronavirus. Then after they realized where it came from, so there was a one relationship with Wuhan seafood market, and most of patients which came to positive corona, they all visited Wuhan sea market. So all of us, it was speculated that it started with sea market and animal market theory. Why is that? Like, because most of virus usually mutate in animal and then came to the human being and then spread. So whatever virus, if you see most of whatever the pandemic virus, they are all mutated in animal. Whether it's a swine, whether it's a blood, whatever is there, but it's the animal or blood is the primary thing. But there is another theory is leak from virology lab, and Mr. Trump are trying to prove that also. So there are two theories that animal market and leak from virology lab.
Now, yeah. Now, go ahead.
Yes.
Okay.
Yeah.
So I think you haven't seen this whole slide. So just briefly, COVID-19 surface droplet is there. Outbreak is in seafood market. This is a seafood market. This was the viral lab which was created during the SARS epidemic, and the theory is there that some virus has leaked from this, and that created the pandemic. But most of patient came in contact with the seafood, so most probably theory is seafood market. But if you see, the distance between the market and the virology lab is not more than 20 miles. So God knows what is the correct thing. But till now we are thinking that seafood market is the probable source of this infection. Now all knows the COVID-19 can present with any sort of symptom, but most common symptom is a respiratory symptom, and second is a GI symptom. Biggest problem is asymptomatic, and most of data looks same. So you can't differentiate on looking on the patient whether he is a COVID-19 or not. So if any one patient is coming to the OPD, you can't differentiate on the looking, examination, or a symptomatic wise. So whenever you start on treating the patient, treat all the patient as a COVID-19 and take all the precaution in thinking that unless and otherwise proved all the patients are COVID-19 positive. So you have to take a proper precautionary measure before treating any patient. Another thing is so many patients are presenting without fever and doesn't have any radiological finding. So that to be also keep in mind that sometimes patient came with another problem like GI symptom, and if you get them the X-ray and came to the negative normal, still patient can have COVID-19. So always think of COVID-19 first in this pandemic. Another big problem is asymptomatic carrier because patient doesn't have any symptom. So sometimes patient comes with another symptom and another one more person as a family member is coming to your cabin, and maybe that relative is asymptomatic carrier and spreading the infection. So that is why avoid the excessive relative and avoid the entry of excessive relatives and normal people in your clinic or maybe your premises. Now, common diagnostic, as you all know, X-ray is not specific. Patient can be present with normal X-ray, so don't rely on X-ray. HRCT is much more specific than X-ray, but it can rule out the COVID, but it gives idea of COVID. So whenever possible, any doubt, get done at least HRCT. If you find a ground glass opacity, more likely a COVID is there. So whenever possible, if you are not able to get the COVID-19 test, at least you have to go through the HRCT and give a slightly have a knowledge regarding the COVID-19. Confirmatory diagnosis, as all know, that is RT-PCR. But there are the immunological diagnosis possible like IgG, IgM, though it's not recommended till now in India because of ICMR has not approved that one. Otherwise, we have another possibility of diagnostic test. So as we all know, in the viral, initially IgM is positive. Once you get the enough amount of IgG, maybe you are immune to the COVID-19. And later part of this epidemic, maybe we should have to do IgG and find out whether you are immune to COVID-19 or not. RT-PCR is a gold standard for a diagnosis. Treatment, as you know, till now there are a few options of treatment: SCQ, azithromycin, steroid, tocilizumab, antiviral, certain antiviral like remdesivir, lopinavir, ritonavir, plasma exchange, and one trial was done of lung transplant in UK. Patient already went through a lung transplant. Result till now we are not knowing. So these are the treatment. As you know, or not, no treatment is evidence based. No, there is no great evidence to support there is a treatment of COVID-19. All are under the base of research purpose. Another possibility SCQ. SCQ is not an antiviral. This is anti-inflammatory or immunomodulated treat. So it's not an antiviral. If you're taking SCQ, doesn't mean you are prevent from the COVID-19. But yeah, it give a certain protectivity measure to getting the COVID-19. Another thing is immunolike cytochrome storm. At that point, tocilizumab may be helpful. Now, coming to a most important topic like lockdown, there are issues that media is giving that lockdown as success or not success. What does it mean? Lockdown was not done to cure COVID-19. So that should be a clear in your mind that in the finishing of lockdown, it's not like that India is free from COVID-19. What was the purpose to do a lockdown? One thing is clear, that infection is going to be with us for years together. So it's not like after 1 or 2 months, COVID-19 will not be there in your diagnosis. COVID-19 will be there in your diagnosis for maybe a couple of years, because it's a virus. It's not going to go anywhere. It's not like elimination or complete destruction of virus. So it's going to be with you. So what is the purpose of lockdown is this, that just flattening of curve. See, if you just imagine, if we wouldn't have gone for lockdown by 22nd of March, then by end of April or maybe in early May month, India would have millions of patients of COVID-19, and there will be a complete collapse of health system as well as the chaotic problem in the whole over the country. So to prevent that, lockdown was done. Lockdown was done to reduce the speed of infectivity and the transmission of disease so that government can procure the adequate medicine, can develop the infrastructure to treat the couple of patients. So that is why was the purpose of lockdown of Indian lockdown, because otherwise so many patients we can't handle it government, and everywhere was the chaotic problem. So lockdown just is not going to a cure, but it's just a remedy to reduce the transmission. Now what we are in today's condition is two-day pandemic. As you all know, there is a one pandemic is going on, is COVID-19, and another is stupidity. Because if you open the WhatsApp, almost 200, 300 COVID related message will be there, and there will be no any authorization, nothing. Whosoever getting message from anywhere, they're forwarding everything. So it's not like we have to fight for that also, because it's creating unnecessary fear in the public as well as the medical fraternity. So there is a problem of COVID-19, but we made it bigger by just using an unnecessary use of social media. Now this is also scary, though COVID is scary. Okay, I can understand COVID is scary, but it's made very scary by media and social media, because everyone you have see कोरोना नहीं थमेगा, कहर चल रहा है, क्या हो रहा है, कब होगा. This is not the way to treat the corona, or no way to tackle the corona. Why scary? As you know, there is no proper treatment, no vaccine. So you don't have anything in your hand to cure a patient. Another thing, rapid transmission, high mortality, and media admission. These three things, if you see in detail, that is not true. About two things is true. I know that is not treatment available, no vaccine available. But if you see in a viral disease, most of virus doesn't have any proper treatment, and most of virus doesn't have any vaccine also. So it's not necessary every virus should have antiviral and anti-vaccine is available. Though we are afraid of corona because everywhere in media, rapid transmission, high mortality rate, and excessive media coverage of corona. Now just compare the mortality. If you compare with bird flu, the coronavirus mortality is around 2%, 2 to maximum 4%, and most of them in another old age and comorbidity. So if you compare with another viral endemic like Ebola, a bird flu, so it's lesser than routine virus which are endemic before in a world. Another thing, most of cases are milder and treatable, and most of whatever the mortality is happening, that is all in old age and the comorbid condition. So that is to be keep in mind. Everyone will not going to die because of corona. Another thing is transmission. For transmission, we are measuring this R of virus. For corona is 1.4 to 2.5. Means what is mean? One infected person can ability to infect 1.4 to 2.5 susceptible person. So it depends upon the population. It depends upon the what are the preventive care you are taking. So if you compare with another virus like rubella, mumps, HIV, and all measles and small virus, it is very less as compared to the other routine virus. Thing is that lockdown as well as all the preventive measures like social distancing, hand washing is affecting this RO. More you use all the preventive measure, this RO will reduce. If you don't follow the government guideline or medical guideline, it will rise, because more you gather together, we are making gathering, then it will rise. So this is you have to keep in mind that corona is not that the lethal weapon like situation. Now almost near today is the last day of lockdown 4, and you all know this last 15 days of lockdown 4, almost every activity is started, almost 50% of all activity has started. And though there are the increase in incidence of viral, but there's a mortality remains the same only. Now from tomorrow onward there will be unlock 1, and we are going to start the normal routine activity. So our main purpose till now, I just introduce you a corona and corona related problem. Now our main concern is now from tomorrow onward, everyone has to start working. because someday we have to start working. So tomorrow maybe we have to start working. We are going to, so many people are taking patients since long, but now they are increasing the OPD hours, they are increasing the patient intake. So we are getting a very high chance of getting infection and infecting other people. So that is why what we have to look for a Surat. Just I'm giving a broad idea. This is a map of Surat. There are the red dot. That is the red zone declared by a government or a district authority. So what you can do that if you are some patient or people coming from this area, we have to more precautious than the another normal or non-quarantine area or non-containment area. So that is the first thing. If any medical representative or whoever going for a doctor visit, he should avoid this type of area. Another thing, if medical representative are residing in this area, they should avoid the taking calls to the doctor because there is a chance of getting infection is very high. Another good initiative by government of India is Arogya Setu. I think everyone should mention the poster on the outside of all the OPD that every patient should install this, start the Bluetooth and Wi-Fi. Then and then government can trace everyone because you are going to come in contact with multiple person within one day. As a medical healthcare and even medical representative, they are going to come in contact with many people, and most of them are there are ill or maybe a patient. So the chance of COVID positive is very high as compared to the normal lay people. So whenever you are having a Gorogyo Setu, it will directly alert you whenever you come in contact. Because if one patient you have seen today, and after 5 days he came to a COVID-19, it will alert you that one of your patient came to the COVID-19. You can take a prophylactic measure and you can have a more precautious measure like you at least fever and cough. You're getting a fever and cough. You go through the testing earlier. So this is one of the app that everyone should install and activate because most of these people have installed, but if they are not starting Bluetooth and location measurement, then it will not helpful. Now we are starting OPD, so two thing will be there for a doctor and who's are coming to the to see a doctor. One is a patient who is going to come to the doctor clinic, and another is medical representative. Because they are the people they have to promote the business because all last 2 months everything is stopped. So someone because they have a pressure of company and all, they have to start a business. So what precaution we should take before starting OPD and what precaution representative can have to take before visiting the doctor. So for a doctor, concern is staff, whether staff will come or not, whether public will harass, whether government is going to harass because you are going to see a patient. Your OPD is small, your family, you are concerned with family because you are coming in contact with so many patients. So first thing is epidemic act that given both things, even protection and penalty. If you are not following the government guideline, if our government is asking to see a patient, if you are not seeing, then government is bound to give a penalty and you are not away from that. So if government is telling that you have to work for a patient, then you should work. Another thing, protection. Protection means in during the pandemic condition, if something goes wrong, non-intentionally, not intentionally, non-intentionally something goes wrong, then government will protect you. So that is the way government epidemic act will protect you also during this pandemic. For patient and for a doctor, telephonic screening is must. Before coming to the doctor clinic, I advise all the patient to telephone me and just briefly summarize the complaint so I can triage the patient whether I ask the patient to come down, whether I ask the patient to come to the triage area, whether I will advise on phone only. So certain patient I advise directly on the phone only because I don't want to come in contact with patient and I don't want patient to become in contact with hospital facility. So that is why we have to triage the patient on telephonically. But there are the things that telephone consultation can be harmful. First thing is you have to consult only your non or post patient. Don't consult the first patient. Means some person is calling and telling you on telephone consultation, you haven't seen any time, don't consult, because we don't know previous thing, we haven't examined in single time with that patient. So only regular patient, follow-up patient, give a telephone consult, and always keep the record, because it may be helpful in the past. So this is for a doctor. Another thing, we are giving a e-prescription that will reduce the contact with paper-induced contact. Okay. Thing is, for a medical representative, always call the doctor or a doctor's clinic and reception and take a proper appointment and go. Don't go there and gather and create a crowd. And don't go in excessive person. Means medical representative will come, the manager will come, 2, 3, all people will come. Don't go with things. Go for a one person only. And before telephone appointment is must be for only. Another thing, whenever you are going, if you are going to the doctor clinic, whatever you want to tell us briefly and go fast, because as much as you increase the contact time, the chance of getting infection is increasing. Then for a doctor, how to set up the ideal setup, like separating, usually if enough space is available, separate the examining area and sitting area. If you are sitting on a clinic of like a consulting room, ask the patient to sit or maybe sleep in another vacant room, go there and examine and write down whatever your prescription is there. If possible, put some glass barrier or plastic barrier in between. No excessive relative, no like an unnecessary people to come. Always put a circle vote for a social distancing, and all the person who is entering the hospital premises should wear the mask and hand sanitizer. This is the must for everyone, whatever is the, whether it is a medical representative, layman, patient, relative, whoever are coming. This is the standard thing you have to do. In our hospital, we have tried to do like this, because there's a three chair combo is there. So we put a marking on the middle chair, you should do not sit here, so at least creating some social distancing here. And even in a reception area, we have put the chair here, so at least for reception person can be social distancing from the patient and relative by at least for 3 to 6 feet. So this type of, I tell the Indian jugaad we can do in our day-to-day activity. Now temperature, usually they recommended that you keep the temperature between 24 to 30 degree in your premises, and humidity at least around the 40 degree, and ensure that adequate ventilation is there. Now another problem with doctor, like we have a phone, key, wallet, pen, belt, jewelry, water bag, tiffin, everything will be there. Reduce as much as possible, because this is the contact borne disease. More contact, more it will spread. So that reduce as much as possible. Your personal belongings as less as possible. So avoid the unnecessary like watch and wrist watch, bracelet, this type of thing. Avoid as much as possible. PPE, this is the most common. We should use the PPE or not. PPE, all like standard PPE, we don't need. The standard PPE only will require the patient or a person who is directly treating COVID positive, or who is doing a duty in COVID positive ward, or is going to see a patient who is confirmed case of COVID now positive. PPE is there only usually, because unnecessary use will create a more financial problem. Gown, scrub should maybe prefer, if you have enough scrub in your hospital, better to come to the hospital, change your routine cloth to the scrub, and do a whatever work. At the time of going, you change your scrub to the routine cloth. That is the way we can avoid the infection. Now mask, why is important? This I think everyone has seen, gone through this in WhatsApp messages, because patient and doctor or whatever the person, both are, if using the mask, transmission rate is reduced below the 1.5 percentage. For which mask to be used, that is the more common person in general as well as the doctor. I am getting so many calls from general practitioner that which mask should be used. So for a doctor, I prefer to use of N95, because we are going to come in contact definitely, and we are going to contact with so many patients, so we should use N95. For a person, either a patient, relative or layman, can use a 3-layer mask. No need to put on N95 of this patient. Okay. For medical representative, if they have a limited work, then 3-layer is okay. If they are going to visit more patient, more doctors visit in like 5 or 10 doctor within one day, then better to put on N95 mask. That is the standard of care. So N95 mask. Another thing to put on N95 mask, keep a full sleeve on the N90. Full seal should be there. This type food is available, but this is for just operative procedure where aerosol generation is there. This respirator are looking very good, but that is not used for us because it's only for who's ever doing a surgery or there is a high chance of aerosol generation. This type of mask, like fashionable masks, are available nowadays, and you are going to see because it's just fashion of mask. Shoe cover, yeah. If you have a shoe cover, you should use because whatever the surface is containing the virus, chance of getting a virus is high. So if you have a facility to have a shoe cover, you should use. Now complete PPE, this is the complete PPE that you should use only in a specific region. uh, Gloves you have to must because in a medical personnel god is gloves is must because you are going to touch so many patients, so gloves is must. Face shield is for if you are treating OPD patient, face shield is must because the chances of getting aerosol generation and droplet infection is very high. So use a face shield as much as possible. So for OPD, three things is important. One is mask, gloves, and the face shield or a global. These three things is important for a doctor in starting a OPD. Now for medical representative, they have to use a mask, preferably N95. They can use a face shield and the gloves. This is a must because they also are the same risk because they are going to change at least visiting the 5 to 10 doctor, and that all are having a maximum patient load, and we don't know about the infectivity of patient and whatever the person who is coming to the contact. So this is one. Mask, before using mask, always try don't touch on front stage. Always there is a procedure to use a mask. Don't touch a front, always touch from behind. Whenever you are removing or putting a mask, always touch behind. When you are touching a front seat of mask, always do a hand sanitization. Anywhere you are touching means you are, if you are handshaking someone, you are if you are touching someone, do a hand sanitization before and after. That is the must thing before using this. Replace mask. There are few things. 3-layer mask is disposable. You should not use repeatedly. N95. There are extended use N95 are available. That you have to take a 5 or 6 masks together. Use first day one mask. Put on the paper bag. Allow it to dry and use after 5 to 6 days. So you can repeat this cycle for at least 3 to 5 times. If you are doing a duty in high risk zone like COVID-19 positive patient, then repetition will be at 2 or 3. So in OPD, if you are doing 1 or 2 hours, it is okay. If you are repeating 3 to 4 times or maybe 5 times. So N95 mask you can extend it use by repeating. Now in the clinic, first thing, avoid paper as much as possible. Use a technology as much as possible. So computer, if you prescribing, use a computer and e-generated computer prescription, or ask some assistant to write the prescription because if you are examining patient and then after you are writing the prescription, chance of infection spreading is very high to the pain and everything is there. So if one person is examining the patient, if doctor is examining the patient and advising that, then another one person should be there to write down the whatever order is there. So it prevents the transmission of infection. Another thing, education. Put an adequate poster in the clinic for social distancing, hand washing, cough etiquette, mask etiquette. So at least people should know about the proper hand hygiene and the social distancing. For Stetho, something like this you can do to avoid the direct transmission. Use Stetho as less as possible, because this is the one point, because we are so much used to use a Stetho and we are touching Stetho so frequently, chance of getting infection is very high. Now this type of poster we can keep in outside the clinic. Another thing for like in my OPD, what we tried, one entry for patient only, another entry for staff and any other accessory person. So patient entry and our staff entry should be a different one. So it reduces the contamination of area. Another thing, if you have a clinic with biometric, avoid the biometric, because thumb scanning may increase the chance of infection. If you have a retina scanning, that may be a best. Otherwise, use some alternative way. Always do a sanitization before receiving any articles from outside. Like if you are ordering some medical like pint and all, if you are delivering that, try to disinfect it before entering in premises. All my patient, relative, whatever, whoever, means even I am coming to the hospital, I should through a thermal screening, even staff, everything, because we don't know who is going to get the infection. So whoever entering in premises should undergo a thermal screening, and if you find anything, do a specific measure. Another thing, all the staff should wear a mask, because it's not like only patient is giving an infection to us. Sometimes staff and we also can give an infection to patient. We don't know, we are asymptomatic carrier, so we should wear the mask, so at least we can prevent the transmission of infection. Now visitor, as I before only mentioned, staff, visitor, patient, all should have Arogya Setu app in their mobile and start and install and start. Social distancing is the must, hand hygiene is the must. All the posters should be in the day, so at least they will create a education in a clinic. Disinfection, there are so many solutions are available, but most common is 1% sodium hypochlorite, and that can be used in disinfection the routine, our whatever the belongs are there. Now certain protocol should be there for on, like what you are going to do if you are having a some patient are coming, what protocol should be there. So if you getting some patient who is entering in the premises, first thermal scanning, he or she has a mask, hand sanitization is properly, just check out this, then put a proper waiting, no excessive crowding should be there, give an appointment according to timing only, one person in a cabin only, not more than 2% in a cabin. Don't touch unnecessary, don't use Setho unnecessary, don't touch anterior part of 95 mask frequently. Every patient, after every patient scene, don't remove the mask and put the mask in OPD also. Now before starting work, you should know that everything is there with you, because if you don't have a mask, don't start OPD. So everything, whatever is required in adequate quantity, you should have before starting your OPD or your function. As I told before, unnecessary things should be removed before. Like unnecessary thing, there's some flower pot, some decorative should be removed from your table, or whatever the consulting table should be removed before starting routine work. Once you open, then you have to care for everything, so it's not like excuse that I don't have this one. So before starting your day, you should know that I have adequate material is available. Sometimes we are at present I'm doing like that, we are restricting the time and we are dividing the patient, like febrile patient come in a separate time, a febrile patient come in a separate time, routine patient will come in separate time. So that way we just reduce the transmission of patient. Whenever coming patient, mask is must, relative is low, every time this is on. Now before starting, just I told before, disinfect your table, all the necessary belongings. Now, so what happened when you are doing your duty and you find out that COVID-19 patient came to you, or maybe one of your patient who is admitted, or maybe you examined before and came to COVID-19. So what you can do? First thing, don't uh, don't panic. Don't panic, because COVID is not the like any weapon that is going to kill you. So it's one disease. We are coming in and out every day. So many virus. So it's not like we are going to die. So don't panic that one. Give appropriate information to the authority. If you are admitted patient, then preferably shift to the adequate designated COVID hospital. If it's not in a shiftable position, then you should shift in another room, which is isolated room, and designate the certain staff for that COVID-19 patient. Don't make unnecessary haphazard management just because of fear of getting COVID-19, because this is just like one of the virus. So don't do anything now. Now all contact, once you come to contact with COVID-19, at least you should also be in a observation for a fever, cough, any respiratory symptom. Use a proper mask, and hygiene, and social distancing. And if any symptom is there, early testing is required. Reuse of PPE, as per protocol, they are not allowing reuse of PPE, full kit of PPE, but certain thing you can use like face shield and goggle, we can use as a disposable. So whenever you have a face shield, after completing work, immerse that face shield in 0.5% sodium hydrochloride, and then after clean with 70% alcohol. So this is my just brief knowledge to the medical personnel. What should we do when starting work? Now, for a medical representative, you have to consider like you are not in a layman, or you are not in a healthcare personnel, but you are a very high chance of getting infection, because you are going to visit the places which are very much infected, like whatever the doctor, clinic, or maybe hospital. So you have to take your proper precaution just like a doctor. So whenever going medical representative, whenever going for a work or a doctor calling visit, I preferably advise that medical representatives should avoid the in-person visit, at least for 1 or 2 months from now onward, because still we have in a high peak of infection. And personally, meeting doctor is not going to help a lot. So better either use a social media or a phone teleconsultation, or phoning of the patient is better than directly come in contact with the health facility if it's avoidable. But if you are going, you have to go, then do a proper precaution like mask, hand hygiene, and face shield, if possible, face shield. And another thing is, whenever you see any like fever or cough or any sign of infection, urgently urgently take a medical help and go through a RT-PCR. So at least we can find out early asymptomatic or symptomatic disease early stage. Uh, First thing is our main motto was they stay home and stay safe. We almost enjoyed 2 months stay home, so I think is more than enough in our life. I don't think we will get this type of leisure next time. And maybe now we have to work, so we have to take some precaution. So this was the before that internet, we enjoy a lot web series and everything. We enjoy a lot food. Most of doctor and all are putting the weight a lot. So now time is gone. Now we have to start working. So it's not like we are going to die, because if you see, mortality rate is 2 to 4%. So even all India is infected, still 2 to 3 4% is only going to die. So everyone is not going to die. So don't afraid of so much. Take it take proper precaution. Don't panic, and don't do a so scary thing like in social media. So corona is not like ajar amar, but it's going to go. But someday it will go. It will go. So nothing is going to last forever. So thank you very much, Hitcon, for giving me an opportunity for this nice lecture.